Good evening, and welcome back to the New York Immigration Coalition Test, Trace, and Take Care video series. My name is Lovely Tejada, the Manager of Community Engagement at the New York Immigration Coalition, and I will be your host. For those of you that joined us last year, you are aware that the New York Immigration Coalition put together a series of videos to share information and resources about the New York City Health and Hospitals Test, Trace, and Take Care campaign. We concluded our 4-video series last fall, but we're back this year to continue providing you with accurate information on COVID-19 developments. Next, we will deliver a presentation on what we know so far about the COVID-19 vaccine, followed by live questions from the audience. You can access our previous content on testing, tracing, and best practices to care for yourself or a loved one with COVID-19 here on our organization's YouTube account. Each video has Spanish, Mandarin, and English subtitles. You can always find a Health and Hospitals testing site near you by visiting nychealthandhospitals.org/COVID-19 testing sites. Vaccines help people develop immunity from a disease so their body can defend against the disease if exposed to it. The COVID-19 vaccine is an mRNA vaccine. An mRNA vaccine does not contain the actual virus. So how does it work? The vaccine enters the body with instructions. The body produces proteins and antibodies, and then the body destroys the mRNA. If later exposed to the virus, the body already knows how to fight it. The COVID-19 vaccine is being distributed in phases, starting with groups of people at increased risk of COVID-19 exposure or severe COVID-19 illness. The phase distribution will take some time, and vaccines are not expected to be widely available to all New Yorkers until mid-2021. The different phases of COVID-19 vaccine distribution are determined by New York State and may change. New York City is committed to ensuring that access to the vaccine is fair and equitable. New York City Health and Hospitals is a leader in COVID-19 testing and now COVID-19 vaccination. They offer the vaccine to employees and other healthcare workers in the Group 1A. As of January 11th, they added Group 1B, which means that they offer vaccinations to New Yorkers 65 years of age and older, and certain frontline essential workers like teachers and other education workers, including childcare staff, grocery store workers who interact with the public, restaurant workers, first responders, public safety workers, taxi drivers, and public transit workers. On February 15th, people with certain pre-existing medical conditions became eligible for COVID-19 vaccination. This includes people who are pregnant and those with chronic conditions, including cancer, diabetes, heart disease, and pulmonary disease. Vaccines are available by appointment only. For the complete list of eligible groups, please visit nyc.gov/COVID vaccine. You can always turn to this link to get the latest information on who is eligible for the vaccine. Vaccines are an important tool in preventing COVID-19. The Food and Drug Administration has authorized the Pfizer, BioNTech, and Moderna COVID-19 vaccines for emergency use. In clinical trials, both the Pfizer and Moderna vaccines were shown to be safe and greater than 94% effective at preventing symptoms and decreasing severe COVID-19 infection among study volunteers. The Moderna and Pfizer vaccines work by teaching the body to create an immune response for a virus that's not present in the body. The Pfizer and Moderna vaccines each require 2 doses through shots in the arm. Your healthcare provider will inform you when you need to return for your second dose. It's important to get both doses of the COVID-19 vaccine that will build 50% immunity with the first dose and 95% immunity with the second dose. Visit nyc.gov/vaccine finder to find out where you can get vaccinated. You can also visit nychealthandhospitals.org/COVID-19 vaccines. For appointments by phone, call 877-VAX4-NYC or 877-829-4692. All appointments must be made in advance. You will need to complete the New York State COVID-19 vaccine form found at vaccineform.health.ny.gov in order to get vaccinated. New York State requires the healthcare provider administering the vaccine to check that you completed the form. If you're eligible for the vaccine based on employment, you must provide proof of employment in New York, such as an employee ID card, a letter from your employer, or affiliated organization or a recent pay stub. The New York Immigration Coalition is advocating to remove this requirement since it's potentially a significant barrier for people without work authorization. Please continue to visit vaccinefinder.nyc.gov for the latest information on required documentation to receive the vaccine. If you believe you're eligible to be vaccinated but cannot prove your employment, please contact the NYIC at mhadler@nyic.org. If you are eligible for the vaccine based on your age, you must show proof of age and New York residency. Proof of age may include a driver's license or a non-driver ID, an ID NYC card, a birth certificate issued by a state or local government, a current US passport or valid foreign passport, a permanent resident card, a certificate of naturalization or citizenship, a life insurance policy with a birth date, or a marriage certificate with a birth date. Proof of residency may include one of the following: state or government issued ID, a statement from your landlord, a current rent receipt or lease, mortgage records, or two of the following: a statement from another person, current mail, or school records. Before you visit a vaccination site, keep the following tips in mind. Reschedule your appointment if you aren't feeling well on the day of your appointment. Wear a face covering to your appointment. You will not be allowed into the site without one. And for more information on vaccine safety and effectiveness, visit nyc.gov/COVID vaccine. COVID vaccination will help protect you from getting COVID-19. You may have some side effects, which are normal signs that your body is building protection. These side effects may affect your ability to do daily activities, but they should go away in a few days. On the arm where you got the shot, you may experience pain or swelling, and throughout the rest of your body, you may experience fever, chills, tiredness, or headache. If you have pain or discomfort, talk to your doctor about taking an over-the-counter medicine such as ibuprofen or acetaminophen. To reduce pain and discomfort where you got the shot, apply a clean, cool, wet washcloth over the area, or use or exercise your arm. To reduce discomfort from a fever, drink plenty of fluids and dress lightly. In most cases, discomfort from fever or pain is normal. Contact your doctor or healthcare provider if the redness or tenderness where you got the shot increases after 24 hours, or if your side effects are worrying you or do not seem to be going away after a few days. Both COVID-19 mRNA vaccines will need 2 shots to get the most protection. The timing between your first and second shot depends on which vaccine you received. You should get your second shot for the Pfizer BioNTech 3 weeks or 21 days after your first shot. For the Moderna, 1 month or 28 days after your first shot. You should get your second shot as close to the recommended 3-week or 1 month interval as possible. You should not get the second dose earlier than the recommended interval. Your second appointment will be scheduled for the same time at the same location following your first dose. You will receive a card on site with the date and time indicated, and a confirmation email will follow a few days later. If you need help scheduling your vaccine appointment for your second shot, contact the location that set up your appointment for assistance. Get the second shot even if you have side effects after the first shot, unless a vaccination provider or your doctor tells you not to get a second shot. In order to do the effective community outreach that's required at this moment, it's just as important to communicate what we do know as it is to communicate what we don't know. We don't know how long protection from the vaccine lasts, whether additional doses will be needed, whether the vaccine is safe and effective for children. Studies have started in this group, and limited information on safety and effectiveness for pregnant and breastfeeding people. Even after getting vaccinated, it's important to continue taking proper precautions to help us move closer to the end of the COVID-19 public health emergency. So cover your mouth and nose with a mask when around others. Stay at least 6 feet away from others. Avoid crowds and wash your hands often. While many New Yorkers have been eager to get the vaccine so far, other people are more hesitant. Some of these concerns are rooted in history and the very real examples of racist policies and unequal practices that have disadvantaged communities of color for generations. These concerns are understandable, and our recovery depends on ensuring everyone has access to these safe, effective, and free vaccines. New York State based its COVID-19 vaccine distribution and administration process on the following guiding principles. Safety. New York State will only endorse and distribute a COVID-19 vaccine if it is determined to be safe and will only be used according to the indication under which it is received its authorization or license. This includes continued monitoring and reporting of adverse events after the vaccine is licensed and administered. Effectiveness. New York State will only endorse and distribute a COVID-19 vaccine if it is demonstrated to be appropriately effective in the populations intended for use. Expert approved. New York State will rely on the advice and counsel of recognized clinical experts and scientists to review and approve the safety and effectiveness of every vaccine that is authorized by the federal government for distribution. Equitable and clinically driven distribution. New York State's COVID-19 vaccine distribution plan will be based on standards that prioritize people at higher risk of exposure, illness, and poor outcome. Transparency. New York State will aim to be transparent regarding all aspects of the COVID-19 vaccine distribution, administration, and monitoring process to ensure New Yorkers are fully informed. Use of data. New York State will use powerful data and information technology platforms to guide all parts of the COVID-19 vaccine distribution and administration process to maximize safety, accuracy, and efficiency, and meet all federal reporting requirements, all while maintaining patient privacy. And lastly, privacy and patient safety. New York State will ensure all vaccination processes prioritize patient safety, and all information systems guarantee patient privacy. New York City is determined to ensure equitable access to the COVID-19 vaccine. Here are some of the ways in which the city is working to reach all communities across the 5 boroughs. Opening vaccine sites in communities most impacted by COVID-19, working closely with CBO and clinical partners, and working to provide resources in additional languages. If you're interested in reading more about the Department of Health and Mental Hygiene's Equity Action Plan to advance equitable application of COVID-19 policies and practices, please visit the link on the screen. Lastly, here are various online resources and phone numbers for you to refer to after this town hall. Finding a testing site at nychealthandhospitals.org/COVID-19 testing sites. Make an appointment to get the vaccine at nychealthandhospitals.org COVID-19 vaccines. For the state COVID-19 vaccine tracker, please visit covid19vaccine.health.ny.gov/COVID-19 vaccine tracker. And for the city COVID-19 vaccine tracker, please visit www.nyc.gov/site/doh/COVID/COVID-19 data vaccines.page. Here are some one-pagers on what New Yorkers need to know about the COVID-19 vaccine and how to get the COVID-19 vaccine. And lastly, here are some important phone numbers. If you have questions, call the New York State COVID-19 hotline at 888-364-3065. Call the NYC COVID-19 hotline at 212-COVID-19 or 212-268-4319 to get information about testing sites, advice from medical staff, information about quarantining, mental health support, and more. And for vaccine appointments by phone, call 877-VAX4NYC or 877-829-4692. And that concludes the presentation. Now we'll take a few questions from the audience regarding the COVID-19 vaccine. Have quarantine guidelines shifted? Not that I'm aware of. Do the vaccines work? So 2 COVID-19 vaccines have been approved for emergency use by the FDA, the Pfizer and Moderna vaccines. And in clinical studies, both vaccines were more than 94% effective at protecting participants from COVID-19. Are the vaccines safe? Yes. The COVID-19 vaccines have gone through large clinical trials involving tens of thousands of people of various ages, races, and ethnicities. And the evidence from those studies was closely reviewed by the FDA and independent organizations. And so you can't get COVID-19 from the vaccine. You cannot get COVID-19 from the vaccine. The vaccine does not contain the virus, and it teaches your body's immune system how to fight the virus, so it can fight the virus if you're exposed to it. Should I get the vaccine if I already had COVID-19? Yes. So since it's possible to get COVID-19 again, if you already had it, it's possible to get it again, you should get vaccinated. Also, the vaccine is safe and may boost the protection that your body has already built up. However, if you tested positive for COVID-19 within the last 90 days, consider waiting to get vaccinated, since it's very unlikely that you'll get COVID-19 again during that period. What happens if I test positive for COVID-19 after the first dose? I'm actually not sure. I mean, I would assume that you would have to follow the same protocols that we've been following since the very beginning of COVID-19. Continue to physically distance, wear a mask, quarantine for 14 days, and then wait 90 days until you can retest again and wait for a negative result. But if you have any questions, please speak to your healthcare provider about, what were to happen if you were to get COVID between your first and your second dose. Are there side effects? Yeah, so like we mentioned, it's normal to experience side effects after the first or the second dose of the vaccine. And the common side effects include soreness in the arm where you got the shot, headache, body aches, tiredness, fever. And the side effects can be unpleasant, but getting vaccinated helps protect you and other New Yorkers from getting COVID-19. So if you have any questions or concerns, call 311 or talk to your healthcare provider. Do I need to get both doses of the vaccine? So both of the currently authorized vaccines require 2 doses. So schedule your second dose at least 21 days if you got the Pfizer vaccine, or 28 days if you got the Moderna vaccine after the first dose. Get the second dose no matter how much time has passed. And the vaccine is more effective if you get that second dose. Do we know when more people will be eligible? Um, so if you mean like when it's going to be more widely accessible, yeah, we are predicting that it's going to be more widely accessible sometime during the summer of 2021. If you receive a first vaccination, will you be affected in terms of getting the second dose by any continuing shortages, or are second doses kept in a separate pool with enough on hand to cover everyone who received a second dose? So each individual should be assigned a full vaccine series, which means a first and a second dose should be allocated to you. You should be provided with a scheduled second dose appointment when you leave your first dose appointment. And if you've already received your first dose and did not receive an appointment for your second dose, please contact the provider who administered your first dose. Who can get a vaccine and how much will it cost? Okay, so currently eligible groups include people 65 years of age and older, at-risk healthcare providers, teachers, school staff, first responders, group childcare providers, grocery store workers, taxi drivers, restaurant workers, and more. For the whole list of eligible groups, visit nyc.gov/COVID vaccine distribution. The vaccine is free for everyone. If you have insurance, it may be billed, but you will not be charged a copay. You don't need to share your immigration status to be vaccinated. Getting vaccinated is not a public benefit under the public charge rule. And when you receive the vaccine, your privacy is protected. There are strict laws in place to ensure confidentiality of your personal information. When I get vaccinated, can I stop physical distancing and wearing a face covering? No. So we don't have enough information to say if or when it will be safe to stop physical distancing and wearing face coverings. Until we understand more about the protection that the COVID-19 vaccines provide, everyone must continue the key prevention measures. So stay home if you're sick. If you have COVID-19 or if you've been exposed, maintain at least 6 feet of distance from people who are not members of your household. Wear a face covering over your mouth and nose when outside your home. Wash your hands often with soap and water, or clean them with an alcohol-based hand sanitizer. Are the COVID-19 vaccines effective against the new variants of the virus? So it's normal for a virus to mutate over time and for new variants to occur. Several variants of the virus that cause COVID-19 have been identified, and some of these new variants seem to spread more easily and quickly than others, leading to more cases of COVID-19. Early indications are that the vaccine protects against emerging variants. Detected to date, though the data are preliminary and there are multiple variants. So scientists are working to learn more about these variants and how effective the different vaccines are against them. How can I bring a deceased loved one back to my country? Funeral homes have received guidance from their associations and the CDC regarding transporting remains of the deceased with known or suspected COVID-19 to their home country. But each country has its own protocol and documentation requirements, and funeral homes should contact specific consulates for further guidance. What if I cannot afford a loved one's burial expenses? So, low income New York City residents may be eligible to receive financial assistance to cover funeral expenses for a deceased low income New York City resident. So, during the COVID-19 public health emergency, up to $1,700 may be available where the total expenses are not more than $3,400. So for more information on burial assistance, including the application for burial allowance, is available in multiple languages on HRA's website. You can also call 311 for assistance in multiple languages. Is it still mandated to cremate those that have passed from COVID-19? No. So there are currently no restrictions against or guidelines for embalming, cremating, or burying someone that may or that had or may have had COVID-19. I was hospitalized and am receiving really expensive hospital bills. What do I do? So you can go to communityhealthadvocates.org or call 866-614-5400, 5400, to seek free help from trusted community-based organizations that can help you with healthcare related bills. I went to get the vaccine and was asked for my social security number. Is it required to provide that? No. So healthcare providers should not be requesting social security numbers. If you've been asked for a social security number while trying to get the vaccine, please alert the NYIC at mhadler@nyic.org. Again, if you're eligible for the vaccine based on employment, you must provide proof of employment in New York. So that's an employee ID card, a letter from your employer or affiliated organization, or a recent pay stub. If you're eligible for the vaccine based on your age, you must show proof of age and New York residency. So proof of age may include a driver's license, a non-driver ID, an ID NYC card, a birth certificate, a current US passport or valid foreign passport, a permanent resident card, a certificate of naturalization or citizenship, a life insurance policy with a birth date, or a marriage certificate with a birth date. And proof of residency may include a state or government issued ID, a statement from your landlord, a current rent receipt or lease, mortgage records, or two of the following: a statement from another person, or current mail or school records. Will this presentation be shared online as a resource? Yeah, so you can always find our Test, Trace, and Take Care video series here on Facebook, on our account on Facebook. It's also available on YouTube. So the last 4 videos that are part of the series are on YouTube, on our YouTube account right now. And this video will be available on our YouTube account in just a couple weeks. Great. Well, it doesn't look like there are any more questions in the chat. I want to thank you for tuning in and helping share accurate messaging about New York City's test and trace efforts. Our next virtual town hall will be on Thursday, April 29th, right here on Facebook Live. Please continue to download and share our Test and Trace two-pager, available in Arabic, Bengali, Creole, Mandarin, Spanish, and Russian, and share accurate information on how to prevent the spread of COVID-19. To stay involved with the New York Immigration Coalition, follow us on Facebook, Instagram, and Twitter, and text NYIC to 52886 to stay up to date with our actions and campaigns. Stay safe and enjoy your evening.